Hello everybody, welcome back. This is Dr. Stokes with Bread and Butter Primary Care. I'm actually at a conference right now, so a little bit different background, but thought I'd take some of my time and do some videos. So today we're going to talk about depression, important physical exam findings. So this is an interesting lecture or little talk because usually we don't think a lot about physical exam when we're doing a mental health evaluation. During your rotations and things, you're probably going to find a lot of times psychiatrists don't even have stethoscopes, they don't take vitals. It's really just a history, a conversation, and medication adjustments, and maybe some counseling. But there are a few things that can be helpful and a few things to think about when you're going into a room during your preceptorships or when you're new in your job or whatever and you're evaluating someone for a mental health disorder as far as, well, what should I do with the physical exam? A lot of times, if it's follow-ups, if I know this patient, if we're adjusting medications, then I don't do a lot of actual physical exam. But on initial evaluation, there are some things that are helpful. There's two main things that I think about as far as doing a physical exam for a person who's being seen for depression. One is mental status. And so those aren't necessarily physical exam maneuvers as we usually think of them. It's things like, what's their speech like? Is it slow? Is it pressured? Are they speaking really fast? Is it slurred? Those types of things. What's their mood like? Are they withdrawn? Are they making any eye contact? Do they have a flat affect? A lot of times if you're evaluating someone and maybe they have some schizophrenia, they'll have a very flat affect where it's like there's just no emotion on their face at all. Are they confused? Are they alert and oriented? Are they anxious? Are they manic and jittery and those types of things? And so those are kind of physical exam. So they're things that you just observe the person. And so most of the physical exam in the evaluation of a patient who's being seen for a mood problem like depression is actually observation of the patient while you're taking a history in how they're speaking, how they're presenting, and those types of things. The other part of physical exam that can also be useful and important is any sort of thing that can be an organic condition, a medical condition, that could contribute to depressive symptoms. So if you think about things like hypothyroidism, someone has a really low thyroid, they may feel tired and unmotivated and down, and that might be part of it. People with uncontrolled diabetes might have some of those same symptoms, people with sleep apnea. So those are all things that sometimes will have physical exam findings. So I do generally do a general heart, lung, thyroid, and edema exam when I'm doing an initial examination on a person who's presenting for depression to make sure that there's no obvious changes in the thyroid, that there's no edema in the legs, which will sometimes happen in hypothyroidism as well as uncontrolled diabetes, as well as in a lot of other things that can cause those types of issues. And then a heart exam to make sure there's not like an arrhythmia with anxiety. Sometimes people have panic attacks and it's actually because their heart rhythm's abnormal, and that's what makes them feel panicked. And so those are some things that are actual physical exam findings. So those are probably the two most common things with the physical exam in someone who you're evaluating for depression or other mental health problems. The mental status, how are they presenting, what do they look like, how are they talking, all of those types of things. And then the second part, as far as any physical exam findings that might help point to a medical condition, physical condition, that might be contributing to their symptoms. So not a whole lot as far as physical exam in a mental health visit, but those are some things to think about as you're going in and doing these visits, getting ready to report to your preceptors. Those are some things that would be good to mention as far as, hey, I listened to the heart, it doesn't sound like it's fast, there's no edema or any signs of any sort of hypothyroidism or anything on physical exam. And here's a description of how the patient looks. They appear like they're really depressed, they're looking down, they didn't really look at me during the visit. Or maybe they're speaking super fast, I can't hardly understand them, they're looking all over, they're up off the table and walking around. A description of how the patient's behaving is actually very valuable, and I think if you go in and you give that type of information to your preceptor as you go to present a patient with mental health issues, they're really going to think that that's great. It really adds to it. And so those are my thoughts on physical exam for mental health patients, particularly someone that you're evaluating for depression. And I hope that's helpful, and have a great rest of your day.